The simple truth is that our response to COVID-19 is creating social disruption on a scale unseen by anyone living. For those of us devoted to creating and sustaining systems of care for animals, the news continues to be deeply distressing. We are operating at full capacity, and we fear that surrender and abandonment of animals will only increase during this crisis. We have made a difference in the lives of so many animals here in the Houston region. Thanks to the work of a community of deeply committed volunteers, nonprofit professionals, and shelter staff, outcomes for our animals have improved dramatically. Real change can and has happened all across the country. In this utterly abnormal moment, it is normal to feel anguish, anxiety, and even despair. It is human to fear that the effects of the coronavirus will undo all of our hard work. We've been drawn to care for animals out of deeply felt experiences of compassion and connection with them. At this critical moment, when we feel powerless to help and unable to channel our passion, each of us is at risk of mental health consequences, including depression, self-harm, addiction, and disruptions to our relationships. In a study published in 2019, researchers found that animal care workers were at greater risk of compassion fatigue than any other caregiving group. And their experience of burnout and secondary trauma was more than 3 times greater than that of social workers who responded in the aftermath of 9/11. But we are not as powerless as it seems. Throughout human history, responses to major threats to our existence have required mobilizing our resources, planning our strategies, ensuring we have the supplies we need, and training for deployment. When we leave quarantine, we have to be ready to respond to the needs that we will encounter. And for us to be ready, we have to be honest with ourselves about what we need as human animals. We need sleep, nourishment, exercise, experiences of connection with those who love us, and a felt sense of meaning and purpose. When we ride on airplanes, we hear that if we are sitting next to someone vulnerable when the oxygen masks drop, we have to put ours on first so that we can be there to make sure that that vulnerable person can make it through the emergency. The oxygen masks have dropped in America. Put yours on. Do it for yourself. Do it for those who love you. Do it for the animals.